Hey guys, we're here live. We're going to go ahead and get started here in just a minute. We're going to have a little discussion for the class today because this stuff is new. I've only done abdominal work for maybe 3 or 4 years. I don't think when I went to massage school, I don't even know if it was covered more than maybe just some oil on the abdomen at one point. There was no real detailed discussion in it. And at that time, at least, it wasn't really why I went to massage school anyway. It wasn't something that I had seen a lot of. So I just wanted to be able to talk about it for a second and like how we incorporate it in our practices. I decided to go ahead and do this on a mat. A lot of the classes I've been doing table stuff in the first class, but frankly, I hate setting up the table. Ugh. And for this, it doesn't really make a substantial. If somebody's on the table, I have a tendency, if I'm gonna work on say this side, to have them scoot to the edge of the table so I can sort of hop one hip onto the table so I can sit. That feels more comfortable to me as I'm working with people, but you kind of just be mindful of what works for you. If you wanna stand and lean on the table, I think that's completely fine as well. The class today is not gonna be heavy pressure. We're gonna talk about that in more detail. One of the things that I think happens with abdominal work and the model that we're going to have over the second and third class, and by the way, I'll remind you, we're not here next week. I'm going out of town, so the dates that we have skip 1 week after this class. The model came to me for a session recently that I filmed, and she had seen some other practitioners who practice abdominal work, but who would not work on her, because she had had some sort of abdominal surgery not that long ago. And I kept asking her why those practitioners would not work on her, and she's like, I don't know, they wouldn't even really tell me. She was like, they're just kind of afraid to work on it. And I'm like, you're a body worker, you had a surgery, as far as I know, you've been a woman your entire life. Why can't they just communicate with you and proceed? And it was like, that's why she came to see me. She came to see me. I worked on her for 90 minutes, probably about 2 hours, but 90 minutes was abdominal. And she's like, oh my God, I just felt so much better. I see lots of that in my practice. I talk to a lot of clients who, frankly, they've never had the work. They're like, where did you learn this? What the hell is this? Like, they have tons of questions, especially when it helps them for something they've been having problems with. So when it comes to contraindications, and therapists love using that word, it's contraindication. There's a high comorbidity of various things, because it sounds all medical, right? And contraindication just means like stuff you need to watch out for. I don't want you to be afraid. And the way we're going to get around that fear is by having additional verbal communication with the clients. The verbal communication is going to put the client in control, make them feel that they're working with you together in session, as opposed to, I'm the therapist and I'm doing something to the client. Now, do I want you to be careful about recent surgeries? Yes. Current illness? Yes. If the person's like, I have COVID right now, I'm like, oh, that's probably not it. I don't know how you wound up in my practice. What are you doing? We shouldn't do this. Hernias, unmedicated blood pressure issues, severe abdominal pain. Most of that to me is completely common sense. That's just, par for the course. But I've really made my bread and butter working on the stuff that everybody else is afraid to work on. The pain issues where the other therapists are like, nah, you need a doctor's release. And I go, what's wrong? And they're like, well, I had an injection, a month ago. And I'm like, but the injection was a month ago. Like, what's it for? Like, I asked tons of questions, way more than most clients were familiar with. Just that portion, I can't speak. Just that portion of the verbal communication means that the client starts to look at what I'm doing in a more medical sense. It means that, wow, I've never had anybody ask me, all these questions. And I say, you put on your form here that you're having some sort of like abdominal pain, and I go, where? And they're like, well, in my belly. And I'm like, okay, on the left side, on the right side? And they're like, oh, no, it's like dead center. And I'm like, okay, does it run back, like towards the posterior, towards the back side? Or is it just like just in the front? You know, like what's the issue? When I'm asking them those questions, I'm trying to figure out what I think might be the problem tissue or area that I might be working on. I don't need to know, by the way. A lot of times also, and I'll point this out very, very succinctly, working with women, one of the things I found was I got more women who are interested in the abdominal work than men. One. But women are generally more interested in massage. Do you run about 50-50 in your practice?
Yeah, about that.
About 50-50? Yeah. Every therapist can be a little bit different. Women, when I started working on them, you know, I started to ask about abdominal related issues. And I would say, do you have like severe menstrual cramps or, you know, that sort of thing? And it was just a quick, you know, question related to stuff women deal with. And they're like, yeah, I have super painful cramps. Like I take a fistful of ibuprofen, it hurts so bad. And then I'm like, okay, where does it hurt? Because I'm trying to, again, narrow down. And they're like, right where my uterus is. And I'm like, can you point to it? I mean, I have a general idea about anatomy, but I'm trying to get more information from them. Once I started actually working on the stuff, and I got into something where I would apply, you know, pressure, they would feel some sort of, they're like, that's it. Oh, I'm like, what is that? And they're like, that's my uterus. It's right, that's where it hurts when I have those severe menstrual cramps. My assumption is what we've done is we've really tapped into a cutaneous or subcutaneous nerve running through the abdomen that's causing the issue. I don't dismiss that she says it's her uterus. In fact, one of the things I did as a male therapist in particular was I would, you know, tell clients, listen, I'm a man. I've never had a cycle. I've never given birth to children. I haven't dealt with a lot of those things. I need you to educate me on that. Now, once I got to that point and she's feeling this referred pain, she thinks I'm a genius. She opens up about a miscarriage, pain during sex, this, that, and the other. Like a million, like women's related issues, things that I was like, whoa. Like, because you wouldn't think as a massage therapist, like, why would a client tell me they had a miscarriage?
Because they don't know.
Well, because it doesn't really have anything normally to do with a massage.
Sure.
But then once they're feeling like, wow, he's like accessing stuff essentially down into my pelvic bowl, it changes the nature and the connection of like what's going on. Very gentle pressure. This work is not forceful. I don't think of it as being sharp. I'm not trying to force anything. I want to be clear about that. I want to go over very briefly, and this is just to get a base of reference. So you're dealing with like digestive organs, right? Because when you press on the abdomen underneath the rib cage, people's soft underbelly. We're dealing with those structures. The small intestine is in there, inside a sac, and when we press on it, it's like you can feel stuff start to like slide to the side. Now, what's the difference between what I'm teaching and saying visceral manipulation? There are educators who will tell people that they're going into their abdomen and like moving their kidney around. This is me. Maybe I'll change my tune later. I don't think that holds up to scientific scrutiny. When people start to ask me, even clients are like, I don't understand, dude, this is amazing. What is this and what does it do? I go, we don't have a lot of research on hippies mashing on people's guts. How much, I mean, really, right?
No.
Like how much research, and that's the thing, I'm asking for information. There may be more out there. I have to go to Walt Fritz or some PT and start, digging some stuff out. I want to create enough of a sense of what's going on so that you feel comfortable, but then also give you a sense of the complexity of the structures that we're dealing with. When we're talking about the SI joint, sacroiliac, the sacrum and the ilium, right? Sacroiliac joint. Tons of muscles in the front and the back crossing over that area. And you get a sense when you see the sciatic nerve running down through there, sort of the complex nerve structures that we can be affecting from the work that we're dealing with. We're going into the abdomen in the front, which I think gets very little attention. possibly putting pressure on the psoas directly, debatable. Again, another anterior view. But then because we're working in the anterior, what does it do to the posterior? Do you see how we are almost completely addressing the posterior chain because we put people prone, we put our elbow down, we work on the posterior chain, but we rarely go into the front. And I think that has an effect on the overall structures related to low back pain. I know that if Danielle and I switched out, this is me, I don't have a lot of low back pain. When she worked on me, or will work on me, when she gets all of this relaxed, temporarily I will get a little bit of low back pain. I almost feel like, why did you do that to me? But it's because she softened this entire girdle of flesh. This thing is contracted all the time. How do people feel about just exposing their soft underbelly? Not very. When that girdle of tissue is softened and lets go, my body feels like it starts to spaz a little bit, and it takes me a little time to start contracting this again to get normal everyday tonus so that little bit of low back pain diminishes. When we talk about structures here, I'm still asking questions about the effects that we're having on people's bodies, about the nerves that we are accessing, and inevitably somebody starts talking about the abdominal aorta, and they start talking about the vagus nerve, and I go, awesome. Now, what does the work actually do from a scientific level, double-blind research studies? What are we actually accessing, and what does the work actually do? That's a deeper question that I continue to ask. When I was originally taught this, there are different kinds of abdominal massage. I see Arvigo Maya passed around, which is Mayan abdominal. I see Chinasong, which is initially what I was trained in. So Chinasong comes from like a Taoist Chinese background and philosophy of like Qi. So I am a Thai massage practitioner. I wrote all of this stuff, which was based on, in the first book, Sen lines, and then very quickly I go into anatomy and keep going. And then all of a sudden I wind up in a class and the body work is great, but then they're talking about qi flow in the body, and I'm like, oh my God. So now I have another Asian theory that may or may not hold up to scientific scrutiny, but the body work is great. So what did I do? Incorporated the body work and started asking deeper questions about what it does and why. So the times that I would use this, if I have worked on someone and they say they have low back pain, and they come in and they say, yeah, I've got low back pain, and it's this big, broad thing like across their sacrum. If I've already done the leg work and the hip work and the mobility from intro thigh, and they don't have any change in that big, broad band of pain, I assume that it's actually their psoas. Well, let me flip to that. I'm actually assuming, this is based on what I've seen in clinical practice, not double-blind research studies. This is hearsay. This is me working, right? I'm assuming that there's something up with their psoas. I've seen this time and again, where I can sink down through their abdomen, apply some pressure over what's considered the psoas, and then that pain will dissipate. Greatly reduced low back pain. In addition, if people have issues through their pelvic floor, they have issues with like stuff in the front of their hips, particularly if they're pointing into here instead of into the back. I'm trying to think of other issues. Women with severe menstrual cramps. I don't tend to work on somebody who has severe menstrual cramps when they're on their cycle. I haven't seen, again, getting feedback from women, I haven't seen that there's any issue working on a woman who's in her menstrual cycle, but you also want to make them aware that it is possible that what we're doing may make their flow heavier. I had a young lady, she had Ehlers-Danlos syndrome. Can't take deep compressions, right? Everybody thinks my work is deep compressions and crazy stretches. She's got a connective tissue disorder, which means she's like hypermobile. She doesn't need to stretch. I did very controlled compressions in very specific ways. And then as I continued working with her, she mentioned that she has bad menstrual cramps. I went in, did the abdominal work, and she was like, dude, after the session, like a day or two later, she's like, dude, what the hell did you do? And I was like, what, are you okay? And she's like, dude, I got my cycle. I've never had a period that comfortable. She's like, it normally feels like velociraptors are trying to chew their way out of my body. Like, it was amazing. Now, why did that happen? What was it and what were we accessing that like lessened her menstrual cramp pain? And I'm going to tell you this right now. I've told you this before probably. I think I could run ads in Austin just selling a 90-minute abdominal session, and that's all I focus on. And what's more, I could focus just on severe menstrual cramps. Who's Robert? The crazy menstrual cramp guy. And I could find clients for it. Women, when I talk to them, Danielle is she's a little more political than I would encourage her to be. But women's issues and stuff in Texas right now is kind of weird. What kind of help do women get with menstrual cramps?
Very, very little.
Oh, tons. The doctors listen to women. Yeah. They support them on their feminine journey.
Yeah. Good. It's great. It's great. 10 out of 10 recommend.
So now that we've gone over that and we talked just a little bit again about like major, contraindications, because you guys are communicating with me via text or phone call, again, feel free to message me if you need something specific. But I don't want you to feel uncomfortable or like you can't ask questions while we're here live. I have a towel available and I will be able to assist you however I can. So, no fear, but ample work. I'm going to talk about how I'm going to prep the client. So when we have a client come in, I think there's two ways to go about this. One, you can do a session, and then as you're communicating with the client, discover that they have an issue that might require some of this work. Then you have to kind of walk them into it. I prefer that the person come in expecting something a little different because I'm addressing a problem with a solution. What I'm going to do is I have to have bolsters and blankets here, maybe pillows. I want to prop her so that she feels comfortable with her legs up, so her abdomen is in a relaxed position. So I'm going to grab a blanket. I'm going to come around. I'm going to stack these guys. And then I'm going to roll these up like they're one. And I want to see if I can make a bolster that's big enough for her leg. This big round here. How's that one? Good for that leg? There we go. And I'll grab another. One of the reasons I like these blankets, Danielle's familiar with this conversation from class where students want to argue with me about using pillows, is it's a customizable bolster. Is I can reshape this depending on the size of the client and what we're trying to do. So I'm going to give you the other one. How's that? Cool. When you're down on your sacrum like that, does that feel comfortable? Or do you need the legs to be higher?
No, that's good.
Okay. So if they needed to be higher, I might have to improvise. I've got a foam roller over here. I can put a foam roller down and then put the blankets on top. Like I want you to customize with whatever you have available. If you have pillows, I mean, I've got these guys. Like I could literally take these out and stick these under her legs if I needed to. The main thing is I want to make sure that she's comfortable because she might be there for 45 minutes. Once I get into this, we're going to be in there, and I want her to be able to feel like she can let go and actually relax. But you think those are high enough?
Yeah.
Okay. Then from here, do you normally have like a little more discomfort, like on the right side, left side?
The right side.
Right side is the one? That side? Okay. So I'm gonna go over there. So I'm gonna grab my coconut oil here, make sure I got my water. I'm gonna bring this over. I have to rearrange myself. And I'll bring a towel with me. And here we go. The main issue is the communication with the client. The clients are likely not familiar with therapists verbally communicating with them in session. Everything about massage school teaches us to be quiet, deliver the work, you know, to the person. So when we go in here, Danielle, you said you normally feel like more pain on this right side.
Yes.
So is it sharp or is it broad?
It's actually both.
Both.
There is typically, right now I'm on my cycle.
Okay.
Just started, so hooray. And there is a constant dull ache that travels from about mid-belly all the way down.
Okay.
And then just like straight stabbing.
Straight stabbing?
Just,
okay.
Yeah, it's just no other descriptor.
You have to build a rapport with the
Yeah.
client or with stabbing in their abdomen.
It's very very cute at times.
So is that when you're like in your cycle?
Oh yeah, like
Okay.
right now,
Okay.
this moment in time.
But like, when you're not having your cycle, you don't get that stabbing pain.
No.
Okay.
No.
So that's the sort of communication that I just want you guys to be aware of. The clients will talk to you about all this stuff. So go ahead.
I also get in my lower abdomen something that basically feels like it's gripping everything and then rolling, and then a general overall belly of like my innards trying to become outwards, which is not the best feeling. And then I also usually get a lot of referred pain down the front side of my thigh. Not so much sciatic, thankfully, but definitely down the front side of my thigh. So this whole area, I would just
The stuff down the front side of the thigh, is that, again, just like the stabbing thing we joked about, is that like intermittent? Like it's something that you get when you're on your cycle?
Yeah, it's only when I'm on my cycle. Sometimes it gets to the point where I can't walk.
Okay.
Because the pain is just so intense.
Yeah.
So a lot of, again, it's only when I'm on my cycle. Typically, not on my cycle, my abs are fine as far as.
So the pain does go away at least.
Yes. Just the.
But then it revisits every month.
Every month.
Like a brutal.
I don't know. I don't know why it doesn't like me. I mean.
Yeah, well, everybody's different. And one of the things I want to point out is these sorts of communications from, in my case, a male therapist. I always deal with those gender things. Women and the way that they interacted with me as a therapist really changed when I started asking questions and like, what's going on and what have you dealt with, and you know, those sorts of things. So have you noticed previously, because we have done some abdominal work, does it usually make things feel better?
Yeah, it does.
Okay.
Yeah, because it just gets to a point where everything just feels like this.
Yeah.
All of the time, and when you work on it, it doesn't feel like that.
Okay. So it just eases some of it. Okay. And then on a pain scale, if 10 is hospital and 0 is no pain, what are you like at?
Today?
Yeah.
Right now, I'm at about 6.
6. Okay.
You know.
And then does it get worse than that sometimes?
Yeah, there are a lot of times where if I could go to the hospital, I would.
Okay.
So
So
I
it almost
haven't
goes to like a
had-
10, all right? And then when you're not on your cycle and things don't hurt, is it just a 0?
Yeah.
Okay. So at least you have some, you know, change, but the thing is, it pretty much, does it go about to a 6 every month?
At least.
At least. Okay.
It usually stands around an 8 or 9.
Okay.
For the first few days.
And then are you taking medication?
Yes.
And then what are you taking?
Lots of anti-inflammatories
Okay.
and painkillers.
Painkillers. Okay.
Muscle relaxers.
In other words, anything in the pharmaceuticals that you can find, you're like, God, please. Yeah.
Kind of, yeah.
Yeah. And the issue is, we just want to help the person out of pain. I'm not going to make medical pronouncements. What I may tell the client is, listen, you know, these are severe issues. My hope is that, you know, a manual intervention will help. I would probably recommend, hey, listen, you know, we're going to do a lighter session today because you're on your cycle. I would love to see you 2 or 3 times before your next cycle so that we can do this. I might even be willing to give her a little bit of a discount, do like, you know, a group of sessions, sell her some sort of package and say, listen, I really want to focus on women's issues related to abdominal pelvic pain. You're like the ideal client. I'd love to, you know, offer you a discount for those 4 sessions, including this one, to be able to like work with you regularly.
And as someone who's actively in pain, I would do that because I would like to not be in this pain.
Yeah. So what I'm going to do now is I'm going to go ahead. Is it okay if I uncover your belly?
Yes.
Okay. So do you have a brassiere on?
Yes.
Cool. So I can essentially tuck part of the shirt underneath, and then I'm also going slow in how I'm addressing this. Like if she's seen me before, she kind of knows the process. But to a client who's never had it before, it's kind of a new thing. So what I'm going to do is, you got 2 different shirts on. I'm going to show you. I'm going to take this shirt and just lift it up, including the posterior side, And I'm going to lift it up to what I think is about the brassiere line, about right there. And then is it okay if I lift the shirt up to about that line again? Because I can feel the bottom edge there. So I'm going to lift this guy up, slide this up. There we go. And then, yeah, I can get the beginnings of a bra line right there. Is that all comfortable?
Mm-hmm.
Okay. And then from here, I'm gonna take my towel, and what I'm gonna do is I'm gonna hook in here, and then I want to be able to come in and actually just tuck this into her pants. This is gonna prevent me getting any like coconut oil on her clothes. And in addition, I have these nice new sheets here, this purple. I went ahead and grabbed an old sheet and put it down, because if I use any coconut oil and it kind of rolls down onto the sheet, it's just going to get on this guy, which this is an old sheet, doesn't really much matter to me. And then, do you feel like overly exposed there?
No.
Pretty good? All right. So I'm going to come in and I want to be able to sit comfortably. For me, that's probably something like this. I can sit with my legs just comfortably crossed. I'm also close enough where, depending on your height, you might be able to sit on the edge of the bolster there to get a little more leverage. But I do want to feel comfortable as I do this. I'm going to get some coconut oil here, and I'll put a little bit in my hand, and I'm going to hold it here. And then what I'm going to do is hold it over. I'm trying to warm this before I put it on her skin. If I just drop cold coconut oil on her skin, it's not gonna, not fun. So I'm letting this melt in my hand, and it's almost starting to run like out the side. Then I can take advantage of that and turn and just start to pour that little bit. If I get too much, I'm just gonna gently swipe here so I can spread some of that out. And that turned liquid super fast. Then the side of my hand, so the coconut oil is here, would continue to sort of pour there. I'm just going to gently spread that, and then if it's melted, you can't see anymore, then I'm going to use very broad, gentle, circular motion. People will tell me that you do this in clockwise only. I heard this in a Thai massage class one time. So if you do abdominal work, you only go clockwise, because that's the direction that the large intestine follows. And then the question was, okay, so if we do it in reverse, like what happens? And they're like, well, going with the large intestine encourages digestion. But if someone had diarrhea, we would go in reverse. And I say, if someone has diarrhea, I'm not touching their belly. I like my mats too much. But it's just one of those weird, conversations, right? So this stage, I'm still just spreading this. I'm coming in, I'm just spreading the oil around.
A little more gentle here.
Okay.
Because it's numb.
So already when I pressed in there, it was numb?
Mm-hmm.
Okay.
It's numb from my C-sections.
There you go. So here's the thing. What did she say? It's numb from my C-sections. And I go, oh, cool. Thank you for letting me know. I've never had a C-section. Has it been numb like the entire time since you originally had it? Is that from the first kid?
Yeah.
Yeah, okay. And then is that too much pressure?
Okay.
It is still a little bit? Okay, so I'm gonna back off more. How's that? Okay. So what I want to do is I want to change it up a little bit. Like I could just continue making circles, but she wanted really, really light pressure. I'm gonna change my hand position. How's this? There we go. So it was just a little bit too much. I don't think she would have been angry at me if I just continued doing what I was doing. But how does she feel when she asks me to back off just a little bit, and I do?
I feel like you're listening to me.
Yes. One of the things I found in my many years of massage service to women is women don't feel very listened to. Guys, take note of this. Is it too much pressure?
No, that's good.
Okay. And then I'm really, really slowly, I slowed down here because I'm just trying to find out what's going on for her as I'm coming around. And then if I gently kind of almost twist. Okay. I'm gonna back off the pressure a little bit. How's that?
That's much better.
Much better. There we go. Now that's kind of grabbing the abdomen and sliding this way. What happens if I grab here and slide the opposite direction?
That feels a lot better.
See, and here's the thing. I don't know what she's going to like. I don't know what's going to be the best, position for her. So if I'm here, I'm going to go to this upper section, up around like that. We can feel the edge of the rib cage right here. How's this?
That's good.
That's good. Okay. And it doesn't hurt like the bottom portion.
A little bit.
Hurts a little bit. Okay. And again, not much depth. I'm still mostly, to me, I'm like spreading oil and saying hello. So if I hook right here and slide this way, how's that? Okay, it's too deep.
Yeah.
So if I back off, is that better?
Mm-hmm.
Yeah. This is all very much, to me, just saying hello. This is just coming in, applying a little bit of pressure, seeing how she responds. Now, if I go back and over, and this is sort of backwards, remember, like I was talking about going clockwise, and all of a sudden it's like I'm going counterclockwise. How's that?
I don't like that.
You don't like that?
I like pulling in.
Okay. So if I grab from here and then pull in,
That feels much better.
and here's the thing, I don't know why she prefers the pulling in. And I don't much care. It's just now we found something out. This is a big, broad hand. I'm not digging in with the side. I'm not like, sharp in any way. I know that Danielle is not usually particularly excited about abdominal work. She has problems in the area, correct?
Mm-hmm.
Yeah. Now I'm going to grab almost to the center, but again, big and broad palm. And then how is it if I grab here and press up?
It feels, but I mean, it's okay.
Okay. And this is super, super light pressure. This isn't even Swedish.
No, yeah, it feels like
Super, super light.
It's a me issue. It's a me thing.
It's a me issue. But she's had pain in the area when her body attacks her every month. What's her sense of like relationship to this area?
We're not friends.
Yeah, I see your post. You're like, cut it out. Get rid of it.
Whiskey, rum. Bring me more.
Going up slow. So depth is okay.
Mm-hmm.
What about the speed?
It feels good.
Feels good. Okay. And this is super, super slow. I don't want you to feel like you're in a hurry to get anywhere. It's her session. I'm working on her. If you're at home working along with us, you can pick up the pace a little bit. You can kind of push them to their edges, but her edges are pretty superficial, right? And she's had prolonged, agitated, issues with this. Kristen's work has gotten really good, and I have a problem with my left arm. And boy, she kicked my butt recently. Like, I spent an hour going, ugh, 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 because she was working through some old tissue that it's stuck. It's not moving. My nervous system has just shut that area down, and she's good enough now to kind of knead through it progressively and knead through it. And then what happened? Oh, my shoulder hasn't hurt the same way in a week.
Yeah.
How's the broad pressure? Still good?
Yeah.
Okay. If I went against my own teaching, which is in the intro Thai workbook, we talk about this, general to specific, superficial to deep. If I just started diving in with fingers, would she get any benefit from this? No, she would completely lock up. She would completely freeze. She wouldn't trust me. And I think that piece of the communication is a huge, huge component of this work. I've just grabbed there, sliding up. I think 70% of what we do as body workers is communicate. We communicate about people and their bodies, and I dare say that we have better clinical outcomes when the clients trust us. We get better results because the clients know that we actively care about them and like the issues that they're facing. I've gone super, super slow. Is it more intense as I'm going up? I'm getting like your abdominal aorta a little bit. So I'm starting to feel like a pulse there from her abdominal aorta. Am I nervous about that? Boom. Boom. Boom.
Blood.
Boom. Boom. No, not nervous about it. We're not applying a huge amount of pressure to it at the moment. It's just making her more aware of like what's going on. So far we've been doing very light work. Do you get any referred pain? In other words, I'm pressing in one spot. Do you feel pain referring somewhere else?
No.
Okay. So I'm gonna back off here for a second. And she immediately, like, I'm not applying much pressure at all. And she just went, oh, just like, oh, thank God. I've been pushed to my edges, right? So did it just feel like relief, like he's not going to press anymore?
Yeah.
Yeah. But how much of it is like what your body can take,
Mm-hmm.
and how much of it is like you're just concerned because you know, like people digging in your belly?
It's definitely the latter.
Yeah. Okay.
So,
So you liked on this side when I kind of grabbed and pulled over.
yeah,
If I go reverse to what I was talking about and grab over here, how's that?
that feels good.
You prefer that?
Yeah, that's really good.
Okay. So I'm going to try this. I grabbed over there and pulled over. I'm going to continue over to this side and then go back and forth a few times. I just want to see. When I get to this side, and you don't like to pull down. Okay, so I'm going to back it up. Here's the thing. I have to change the session to appeal to the client and what the client is. You like that better. Okay, so here's what I'm going to do. I'm going to treat it like a little ramp. I'm going to grab one side and go up. And then after I go up and I've gotten past the midline, I'm going to lift up, reach over, and then grab and pull back and over again. I'm trying as much as possible, slowly, incrementally, with communication to bring her to her comfortable edge. If I keep leaning on something that hurts, ow, and I keep leaning on something that hurts, ow, is she going to trust me more? Probably not. And we like Danielle to keep working with me. So I'm going to reach over. This time, instead of thinking of like this upper portion or lower, I'm going to kind of grab in the middle. And I've reached a little further over. Do you see how I've kind of reached my hand almost like back? How's that?
That feels so good.
There we go. Now, to get a better grip there, she really liked that. I want to give it more heft. I can't, heft. I'm going to reach and almost grab where I'm lifting. How's that?
Oh, that feels so good.
There we go. Now I'm just leaning my body back. I'm just leaning back and over to try to get some more length right here. Just pulling over. Now this has,
I felt referred pain.
this is a little deeper. Where did you feel the referred pain?
It was all the way to here.
You felt it over here?
Yeah.
So was it superficial or was it kind of
It
deep?
was deep.
Deep, okay. Now, I have no idea why she felt that specifically. I'm gonna back off a little bit just because when I get to over here, probably couldn't apply as much pressure, right?
Yeah.
So I kind of went back to that little jump I was talking about. I go to about the midline. I'm going to disconnect. Now I'm going to reach my hand from this side, and I'm going to see what happens if I grab here because I'm already on this side. I'm going to restack where my legs are. How if I lift from there? How's that? Okay, this feels good to her. I want to do things that feel good. If I don't do things that feel good.
I definitely have referred pain with that too.
Same area?
Yeah, it's deeper as well, and it goes all the way down closer to my pelvis.
Okay.
Pubic symphysis.
So all the way down to your pubic symphysis.
Yeah.
Yeah.
Oh.
Did it feel sharp?
A couple of times, yeah.
Okay. And then she knows pubic symphysis. What would a normal client say?
The lady bits.
Yeah.
It's for
Or
growing.
something like,
Yeah.
so I might have to say, do you feel it all the way down to like your pubic bone?
Mhm.
Or something like that, something a little more clinical, you know. Lady bits is fine, but right in there. Okay. So if I need to reinforce, I'm going to grab my forearm right here just so I got some more weight and lean. When I'm reaching from the other side, I've got a little more pull. I can lean my whole body. From here, it's kind of like I'm pushing, so I just wanted to reinforce with this hand. Is that too sharp when I'm coming out there? Okay.
I'm aware of it though.
Then my little ramp I was talking about, I'm going to disconnect. I'm going to reach over to the other side. And again, do you see how I'm reaching around and I can reposition my legs? I can do this several times. That right there feels good? Okay. If I do that and reach around, and then do that and reach around, does it feel better at the higher portion or lower?
Oh, it's higher too.
The higher feels good. Okay. So I'm getting up towards her clothes there. How about there? Still good?
Very good.
Okay, cool. So I'm gonna reach in just a little bit and slide this guy up. Just give me some more skin right there. There we go. Right there. And I'm leaning down. I'm completely changing my body mechanics, just leaning to be able to get a little pressure right there. This feels nice to me because I can actually put a little more pressure than I could when I was pressing from the front. From the front, guys, it was like I was just moving skin. Like it was almost nothing. From here, it's like I'm mobilizing her pelvis. I'm actually lifting, you know, through here and then like mobilizing her pelvis. Like I'm lifting her sacrum, her ilia, mobilizing the lumbar spine, mobilizing the pelvis as I'm down through here. Does it typically still feel better on the higher portion?
Mm-hmm.
Okay, if I'm right there,
This feels good.
I lift you.
Yeah.
What you got?
Nothing.
No, your facial expression changed, so I was just trying to check and see what was going on there. So I'm gonna switch hands. Now I got a right hand full of coconut oil. If I need to, I can come in and I can actually just use the towel here to wipe my hand off, which I am gonna do because I'm gonna switch to my left. She liked that big pull, so I'm kind of altering my sequence a little bit just to get into what she liked. So same issue as before. I'm coming in. I'm gonna find like a good seated position where I can reach. And then I want to come over and see if I can grab, and I'm going to get more pull this way.
Feels really good.
Feels good right there?
Mm-hmm. Very good.
There we go. And this is still a big broad hand, but it is gripping around so that I can lean. Right.
Oh, it feels so good, and I feel that recurrent pain again going down.
The whole way or just when I get to about there?
About mid, yeah.
About mid. Because when I started, when she brought it up, it sounded like it didn't start that way.
Yeah.
Is that too much pressure?
Yeah.
Okay. And I'm going to keep my hands broad. I could kind of collapse them in and make it a little bit sharper if I wanted, but I'm really going slow. Danielle was also the reason I chose to do this first one with you because the other one's a lot more pressure, and I didn't know if she could take it.
Yeah.
She'd be like, no.
And you guys might have clients like me.
There's a value in working with different models. Yeah. Too sharp? Okay.
Oh, I feel that. Oh, I feel that go down my thigh.
On that right side?
Yeah, I mean, it's good.
Deep inside, like in the bone?
Yeah.
Or superficial?
No, deep, right along that. It's like right where my. Don't move. Sorry.
I want to back off just a little bit. That too much?
No, it's good.
Okay.
It's like where I get the cramping when I can't walk.
Mm-hmm. So, do you see how, and this isn't scripted, the reason I keep doing these classes this way is because this shit is real, okay? Like, when she holds her head, she's making this facial expression like, you know, oh my God, like I'm holding my head here. You know, she's doing what she does, like, oh, she's like, that right there, I feel that right in that part of my leg, that when I can't walk.
Can you go a little deeper?
Okay. So when you want to go a little deeper, you just want to sync with the, you don't need to sharpen, you just want to press in a little bit more. Okay. So right there. There you go. Is that too much?
Yeah.
Now, normally I would just go around in those small little circles. I've completely veered off of my routine, and we're going to talk about this more. I don't want you to feel like, one, I want you to feel like you have a routine, so you have something to fall back on. Two, I want you to feel like you can vary the routine based on the person that you're working on, which is the beginning of that improvisation. Is that too deep?
Yeah, that's good.
Okay. Do you want more than that?
Yeah.
Okay. So what I'm going to do is I can't really pull with this hand anymore without like kind of jeopardizing my body mechanics. What I'm going to do is I'm going to come bring my body up. I'm going to keep my hand where it is. And then I'm going to see if I can reinforce this hand with the other. How's that right there?
Very good.
There we go. Is that still referring down?
Yeah.
Okay. So from here, what I'm going to do is, you don't want any more pressure than that. Okay. Movement. Do you want me to shear more towards the midline
Slowly.
or more lateral?
I think tiny movement.
Okay. If I go towards the midline, is that it right there?
Yeah.
Okay. Now, do you want down or up?
I think like right in there.
Okay. And no change in like my hand position. Nothing's too sharp.
No.
Now, can you give me a big in breath through your nose and then out the mouth? Ah. There we go. Ah. Those big breaths in through the nose and then out through the mouth. The mouth is a bigger pipe. It gets people to not contract their jaw, to not clench and grind their teeth. The breathing actually puts them in a little more control of the depth of pressure that's delivered. Is the referred pain minimized? Like it's diminished some?
Yeah.
Does it still feel like this is too much pressure?
No.
Okay. So my hands are just getting a little tired. I'm going to slowly back out just so we can give her a break. I usually assume when I'm getting tired that they're getting tired. That when I'm, feeling not off, but like that's enough, then I very slowly release. You can see that little bit of red mark there, just where my fingertips were. And I also give her a chance to take a couple of breaths just to see how she feels as I go through that. The reason I focus on that communication is I could have very easily just went like, nope, Danielle, I have a sequence. We have to complete our sequence. And it's like, no, she wanted something specific. The more communication you bring to this, the better your clinical outcomes. I want you to trust me on that. And that communication isn't just verbal. It's also me looking at her facial expressions, and it's making eye contact on occasion, or saying, hey, is that too much pressure? Like, because I don't know. Like, I can make tons of assumptions and just totally railroad her, and then she's not going to get as much out of the session. If I combine verbal and nonverbal communication to be able to tailor the session to her, here's what it does. It increases intimacy. It increases the sense of care and concern the therapist has for them. And here's what it does to my finances. It increases rebooking. She's totally willing, even just after that probably, to be like, yeah, I'd be like, listen, we can't get it all done today. We totally got to have another session. I need to see you 3 more times. I would love to continue working on this, whatever. Do you have a preference? Do you want to do like that sliding pass from this side?
Yeah.
Okay.
The right side definitely needs a lot more work.
And you see how I gave her the option? She could have said, nah, I think that's good. I want to move on to something else. But I don't really know. The difference is also, I think visually, this is some of the most boring body work on earth. I mean, I think this is just painfully boring to look at. It doesn't look like much at all. Like,
not boring to receive.
what does it feel like?
It's very it's not intense is not the word. I fight a lot with this area.
Yeah.
And so now there's a lot of attention, and it's almost overwhelming, but I need it because I'm getting relief. I can feel things not screaming or spasming as much.
Yeah.
So I want more of that, but it's hard to process.
Yeah. And it's a lot all at once.
All at once.
Yeah. People get, and we're not going to go into as much. I mean, she's already having some. Like in some ways, it's like I planned on this being the light class, and all of a sudden it's like I'm feeling crazy, referred pain over, and I'm like, yes. People feel referred pain all over their body. I'm gonna prop myself so I feel comfortable, so I can reach around again, because I want to be able to come in and grab over here, and then start to lift.
Feels really good in my hips.
There we go. Gonna reach lower here, almost grabbing the upper portion like of her ilia, so I can lift part of her lower body right here. And this is big and broad, but it's like I'm over in her case. Like I'm not even really sinking, I think, into the abdomen. Like I'm at this upper portion. But this is where, to me, it all starts to break down. When I talk about being in the ilia right there, it's that upper portion. You can see the ilium. That's the posterior side. Is kind of what I'm grabbing and pulling over. That's the anterior view. But going through here and grabbing, it feels like I'm grabbing skin and just kind of pulling skin over that just a little bit. But I'm trying to do it in a broad enough way so that she's not running away screaming. Ooh, ouch, that question hurts.
What was the question?
Oh. So somebody texted me, and my phone, sometimes I get like a auditory thing, because like I'm a Bluetooth in, and sometimes no. And somebody was asking, like, okay, I'm gonna be an asshole. Somebody's asking how I maintain good body mechanics while doing this on a table. And what do I want to say? You're like, well, you can maintain good body mechanics on a table. It's impossible.
Yeah.
The difference is the mat gives me a bigger platform. I don't want to disparage the table. I make jokes about stuff. I decided to go ahead and do this one on a mat, for better or worse. Like I can change it later if I need to. We can do another version of the class later where I show some of the table stuff. It's not really any different. I would literally have, let's say I have one leg up like this, because this is the table, let's say. Let's say this is the edge of the table. If I'm sitting on the table, I can have a chair where this foot is just in the chair next to the table, because it brings my body weight up. The difference is also I'm doing kind of lighter work on Danielle, but if I want more pressure, which I don't in this case, if I wanted more pressure, it's like I need to stack my body over the person. When I've lifted them up on a table, it makes that a little bit more challenging. The work by its very nature, I think, is a little bit lighter. Also, depends on the shape, dimension, size of your table. Just work with your table like as best you can based on like what you've got. If you're not comfortable, change it. Absolutely, and you have my permission. If you go, well, hey, listen, you know, I want to do this, Robert. I want to turn around completely. Okay, this is going to change the angle. Do I think this is wrong? No, it's just different. So I'm going to grab again just because I want to see what the difference is. And I want to see how people respond to this. If I grab here, what do you think? Right there? That feels good. Does this feel better than the opposite side?
It feels good.
Not any particular change for you.
Correct.
Okay. But the piece is, if it feels better to me, this is the version that I would use. And that's where, again, like there's usually multiple ways of doing things. And I want you to feel comfortable while you guys are doing this. The good thing about the mat work, and you can see me from this position, I'm just hanging out. Like I am leaning, I am using some leverage. She's not asking for a huge amount of pressure, but I'm just sitting and hanging out. This is how I want my practice to be. And if you really go through my curriculum and work on a table, the table is going to start to break down. And you're going to start to go, oh, that's why. That's why he's always talking about the mat. Because you're going to get more access to your legs, more access to your feet. You're going to have more access to multiple points of contact. You're going to have easier delivery of compressions. That's effortless. And that's what I want for your practice. When I'm leaning over right there, you dying?
No, that's great.
Still feels good. And these are super, super slow. Like, I mean, I'm just completely chilling right here. Like she is just, I'm just completely hanging out, leaning over. And for her, this is enough. Now, some of you might be experiencing the same thing and going, I don't get it. What's the big deal? I have clients that I've done abdominal work to, fairly deep even, and I find almost nothing. And this one client I'm thinking of is a male client of mine, and he goes dancing regularly. Loves to dance. He doesn't have any issues through his abdomen. That area, it's all completely free and fluid and moves. He doesn't need this. Does it make sense? He's not the client that this stuff is designed for. How's that? Too sharp? Too deep? Too fast? Digs in too much?
No.
I just made you itch.
Yeah.
So I'm going to back off just a little bit. I kind of released, and she was becoming the itchy.
Yeah, I don't do that. But obviously don't get work.
I'm going to change my body position. And then we kind of did both sides, but she's having more problems with that right side. I'm giving her just a second, like how does this feel when you kind of go back to neutral?
It feels a lot better.
Cool.
Like I'm still feeling cramping here and down, and
Okay.
then here and down as well, and then TFL.
TFL stuff.
Yeah.
Okay. Sometimes I think if you look at it this way, let's say you got layers. You got like 5 layers of muscle tension. Sometimes, unfortunately, what seems to happen is like, let's say you peel away 2 of those layers. Well, now these 3 start to stand out. It doesn't mean that this stuff wasn't here before, by the way. It just means it's not really in their awareness, in their attention. It doesn't grab it. But if you peel away those superficial layers, it's like, oh, I totally feel my TFL. But you might not have come in and reported that. Yeah. Now, I'm going to pick a spot. We're going to go above, below, and to the side of the belly button. I'm going to show this on me because you got to be safe enough to expose my abdomen. We're going to kind of go above and then around in a clockwise direction. I'm doing this in reverse, I think, because it's, anyway. But anyway, you're like an inch or 2 above, an inch or 2 below, and to the sides of the navel itself. And I'm not going to use my fingers. I'm going to use essentially like the heel of my palm. But could it be a little bit more of like middle palm to heel? In other words, she's like, I hope so. Yes, please, God, do not. Yeah. What I'm going to do is I'm trying to figure out how I can stack my body to be able to deliver this in a way that she can receive. So I know that her navel is here. I'm going to come over again, just like an inch or 2. I just want to be able to hook right there, and I'm gonna be intentionally a little more broad than I usually would. And I'm gonna sink down and in slowly. And in her case, I start to get some abdominal aorta. I feel it very big and broad underneath my palm right there. Why is that funny to you?
I don't know.
Abdominal aorta. Well, I didn't call it the carotid. At least I got that part right. So no more pressure than that. Okay. If I'm right there, do you want me to shear up or down?
That's mid. I'm not sure.
Okay. So let me go back to center. She couldn't really choose either or, so I'm going to go back to center. If I'm right there, do you want me to shear a little bit more towards the midline? Too much?
It's like right on that line.
Intense.
Yeah.
Okay. Now I'm on my palm, but I start to lean just a little bit towards the heel. But this is right at the point where she can receive this. I suspect she's having some intensity, like her facial expression changed to like, oh, what's going on right there? Is it too much?
It's like right there though.
Okay. When you say it's right there,
Don't go any deeper.
you have localized pain.
It's not pain, it's just
Intense sensation.
yeah, yes.
Now, do you have any referred pain?
No.
Okay. Does this feel beneficial?
I think so.
Or does it just feel like it's annoying? Quit mashing on my innards.
No, I think it needs to be touched
Okay.
because I'm fighting it so much.
I am going to choose, because we have 3 more points to go. I'm going to back off slowly, and this is super slow. I'm not rushing out of this. I'm really just leaning back just a little bit to release my hand. We're going to see if there's any, like, I would say discoloration, but sometimes you can see on people where my palm was. And in this case, I don't think you can. But I'm going to give her a chance, just like a couple breaths, to sort of settle in before I go on to the next one. Usually, I would go in a clockwise order. Some people argue with you about this. Even though I'm still using the points that I was kind of taught in a class, that it's more of a general guide. When I go in and sync, and then I'm like, hey, do you want me to shear up or down? Do you want me to shear to the midline or lateral? That was my own, like, additional piece with verbal communication, where here's what happens when you use that shear thing. You'll see this in my work constantly, by the way. You can get right to the spot because they tell you that that's it right there. That's it. More pressure or less? No, it's perfect. That's where we want to be, and we can use the communication to help us get there. I'm going to go below now, and I'm going to come in.
That's the area that's numb.
Okay.
Like, I don't have feeling on the surface.
So she's telling me she's numb. I'm assuming she feels a little nervous about me going into the area. So I'm be mindful of that. Does it still feel numb as I, like, sink down?
I feel the pressure deeper. I don't feel any of the surface pressure. I don't feel the warmth of your hand. So that's a little, not uncomfortable, but weird to process and nervous. I feel that much deeper now. Like, it needs work.
Do you need any more pressure than that?
No.
Okay. From there, if I shear over to the right,
That's good.
you like that direction?
Yeah.
Okay. Do you want me to shear down
It's okay.
or up?
It's okay.
Which do you prefer, of the down or up?
It's all kind of the same.
Kind of the same? Okay. So I'm gonna go to the middle. She said it's all kind of the same, which means she wasn't having any particular preference, except it sounded like she wanted me to go more laterally. She wanted me to go more out this way a little bit. So right there?
Yeah.
So there's localized sensation. Do you have any referred pain?
I'm not sure because of the numbness.
Okay.
It all feels kind of referred. It's very, I'm not used to it.
Mm-hmm.
I'm very nervous.
You're not used to pressure there.
I'm not used to pressure or tension or touching
Mm-hmm.
there. It's a lot of awareness.
And this is a pretty broad palm because she seems to have issues on the lower portion and to the right side. I'm probably going to be a little bit lighter through there than I was like over here. And like even her breathing has changed. It's a little more rapid, kind of shallow.
I'm trying to calm down.
So when you say you're trying to calm down, does just work in the area make you nervous?
Yes.
Okay. And my arm was starting to get tired. I'm just going to slowly back out. I could always come in from the other side, you know, give it a second pass if I wanted to. I just want to move on to another point so she can feel something else. And even though she's having, I think, a little bit of an anxious response. Like some of the other stuff, when I did the lifting, I got this nice, soft, relaxing, like, wow, that actually feels nice. I like that. When I was doing that, I got a sense of like, yeah, I know he has to show this for the class, but this is kind of tentative. Yeah, exactly. So I'm going to move to the opposite side. And this is just to make it easy for me to deliver pressure, by the way, because I want to come now over here and hook in with my hand. I want to be able to stack my body in a way that feels comfortable. I spend lots of time like moving myself around so I can make myself comfortable. And I'm trying to go slow, and I'm making this a little more broad. How's that right there, Danielle?
Better.
Okay, not too much? All right.
You can feel it like
Quiver?
yeah.
No force, but there is some leaning in slowly. I don't spend a lot of time worried about, am I pressing on her small intestine? Am I pressing on her large intestine? Am I pressing on her ovaries or uterus? Am I, like, people's organs are probably shaped just a little bit differently, different sizes, slightly different placements, and I don't have x-ray vision. I'm always going to go based on what they tell me and how it feels.
I feel like it's relaxing. And I feel like I'm relaxing around it, around your hand.
I will get to stuff like this and encourage the client to breathe normally by having them take a big in-breath through the nose and then exhale out the mouth.
Definitely feel the first pain like deeper, but in a good way.
So when you say it's deeper, where is the pain?
Oh wow, that's weird. It is like, I guess,
Kind of straight down and through?
yeah, straight down, but not quite my back. In the center, it feels very sharp.
The pain feels sharp.
Yes, the pain feels sharp,
Yeah.
but not what your pressure does.
Yeah.
And it feels like it's working through something
Mhm.
with my hand.
So from where my palm is, it feels sharp, and it feels like it goes down. Does it go down towards your spine?
It goes down towards my navel.
Down towards your navel. Okay.
Yeah.
Kind of like down towards your core, I
Yeah.
guess is a good way of,
Yeah, in the core.
Now, the reason I ask for that much information when I'm doing this to someone is I'm trying to establish a pain pattern. People rarely, in my experience with clients, when I work on chronic pain stuff, they're always amazed that I ask for such detailed information about where they feel it, because sometimes where they feel it gives me an idea of where to go work. She had a little jerk right there, and I wasn't sure if she just started to fall asleep or was it too much pressure.
It's whatever it's doing is working through it.
Yeah. So it feels to me like I'm almost on something, and I've got a constant pressure with this hand, but it's almost like the muscle's kind of quivering, like it wants to let go, but it's like listen, We've maintained our safety and security by maintaining this muscle tension, and then you want to come shake it up, wake it up. Once my hand starts to feel at my wrist in particular, like, hey, I think this is good, then I'm slowly, you can see my body language where I'm stacked right here. I'm just slowly gonna lean out. You can see my torso start to slide out the camera there, because I'm just trying to take that pressure off slowly. You don't, with deep compressions, this holds across the body, but I think particularly in the abdominal work, you don't want to just jump out. It feels like tissue recoils in a way that can be uncomfortable. Then I'm going to give her some time because I want her to kind of, yeah, it's like it gives you a little bit of respite after doing something that's so intense and deep, so that you can just relax for a minute. We're going to do one more and then take like a short break. You guys can take a bathroom break or whatever, come back and start over, kind of go through again. And she's still got this like facial expression. She's just like, ooh, like what's going on? You know, any like significant changes from that?
No, it feels good. I'm having sharp pain in here, I'm guessing for my menstrual cramps.
Okay.
I am noticing though that I've got like quivering in TFL, especially when you were doing all of this deep work. It was just like a flopping fish.
Yeah.
Which was very interesting.
All right. And then what I'm going to do is, again, navel, just like a couple inches. I'm just going to have the heel of my hand there. I'm just going to stack some body weight. I can bring my body over however feels best to me. If you're on a table, again, make yourself comfortable. If you need to, you can have them scoot all the way to one side. Too sharp?
That's good.
Good right there. Okay. I'm getting a huge amount of like abdominal aorta there, but it's underneath. It's not like any sharp pressure. A little too much? Okay, I'm going to back off just a little bit. How's that? Now I'm going to shear a little more to the left or a little more to the right.
Can you go down?
Okay.
Yeah.
Down right there?
Yeah, that's good.
Now, what did going down do? What did the feel, the difference? What was that?
It felt like it took pressure off, but I could accept the work a little bit more.
Okay.
Oh, I feel that referring into my sternum.
Okay. So I've done this, and people go, oh my God, it's like burning in my chest. And I go, okay, like, is it pain? And they're like, no, I'm not like running away. It's just real intense.
Yeah, it's not, yeah.
Now, when we talk about this, okay, you know, there are questions I have. What effect does it start to have because of nerves on different parts of the body, the parasympathetic, the sympathetic, vagus nerve, and for the digestion itself? When I'm pressing around the stomach, around those abdominal structures, does it send nerve, I guess innervation would be a way to say it, up towards the esophagus, up in between, or inside the rib cage, I should say.
I feel it more in, like up underneath my rib cage.
Okay.
Where my gallbladder would be.
And pressure still good? You like the shear down?
Yeah.
Okay. I'm very gently going to slowly come out. And I'm going to show you how, with someone like Danielle, this would be our first session. You know, like I've been using my hands more than I normally do in session because I use my hands for this, not my feet. I'm going to take this upper portion of the towel here. I'm going to place it over her abdomen, and I'm going to start to grab some of that coconut oil in a very soft, kind of nurturing way. What I'm really doing is sopping up the oil and just trying to make that feel kind of nice.
Feels really nice.
Because this is superficial, right? This is kind of what we started with. We went to something that was deeper, where it gets to this point where like it feels like you can't run away. It's very intense. So I want to do this to make sure we don't get coconut oil on her clothes. And then typically what I would do is I would bring the towel down like this, and from an edge, I would very slowly start to pull the towel out and then fix her pants here. And then I'll come up above and grab the shirts and then slowly bring them down so she feels covered again. I'm going to take this guy out because I'm going to use that again. And then very slowly I could transition out. I'm gonna take a guess, but you let me know, Danielle. If I take the bolsters out and if I would put my foot in here and kind of rock your hips, would that make you feel better?
Oh yeah.
Okay. And here's the thing. One of the things I told her about, she was kind of nervous about doing this, was I think the most uncomfortable part of being the model for this specifically is because we're receiving this for so long. We're in a position where she's on her back for like an extended period of time, and I've softened all that girdle that I talked about. What I'm going to do is slowly slide this guy out, and because I'm on a mat, so you couldn't do this on a table, is I'm gonna hook under the leg here, and I'm gonna come out, and then I'm gonna slowly lift. How's that? Okay. And this is just trying to get some movement in her lumbar spine because she's been pressed down into the mat for a minute. So it's too much where I'm pressing on the gluteals? Is that better? Or still too much? Okay. Kind of broad. Is that better? There we go. And this is more to like mobilize her lumbar spine. I'm quickly going to go to the other side just to do the same. And I want to see if it feels better or worse or different on one side or the other. How's that?
That's good.
There we go. This feels easier on this
Yeah,
side.
much easier, yeah.
Okay. There you go. In this case, you guys can go ahead and take a quick break. I'm going to come back here in just a minute and give you kind of the second half of the trade, but I want to give you a second to go to the restroom so you have a chance to like get a sip of water, go to the bathroom. We'll be back in just a minute. While Danielle is finishing up, I'm going to go ahead and kind of go over the spiel again. I know that we had a chance to talk in the beginning, but it's a little different when like you just received and now you got to give. So I want to give you a chance to kind of wake up. We're going to talk about and go over some of the anatomy again. You know, when we're dealing with large intestine, small intestine, gallbladder, liver, stomach, pancreas, on and on, I do think that we're having some effect on digestive organs in relation to lymph flow through the abdomen and then also on cardiovascular supply. The same thing happens, I assume, you know, from a smooth muscle tissue, because smooth muscle tissue is organs, right? You don't got to think about it. It's a different part of the nervous system. Skeletal muscle is where you can, you know, consciously control it. But any kind of tissue, when you know, rub an area, has to have some effect on cardiovascular supply. That's just the way that I see having some effect. As we're going through and working on the pelvis, you know, you're working around all of this, not only skeletal muscle through the abdomen that we're softening, but you're probably having an effect on the posterior and anterior muscles themselves that are wrapped around. The psoas gets a lot of lip service in the massage community. Massage therapists are very like fixated on it as like a special muscle. And I do think that some people have issues with it. That very broad pain I talked about is the one that I see the most. 9 times out of 10, if I've done the other work that I mentioned from like intro tie, If I've done the leg work and the pelvis work and the hip work and they're still having that low back pain, the psoas is where I tend to go. I tend to go in, do some manual psoas work, and I've seen relief for clients doing that. And I ask tons of questions about what is this doing to someone's nervous system? What is working through this area, this innervation, in the same way that we work on skeletal muscles accessing cutaneous and subcutaneous nerves? What happens through the abdomen? And these are questions. I mean, I'm a former philosophy student. I'm thinking about this. I'm asking questions, trying to figure out what is it we're actually working on. Why are the people having that response? When you're ready, you can come on in. I don't always know. I try to give simple answers to clients and say, I don't know, why does it do this? And I'm like, nerves. I mean, I know that sounds like a smart ass answer, but there are points at which I'm essentially working, even though it's under my massage license, I feel like it's out of my pay grade, where I wish that I knew enough to be like, oh, this is a section of, like if I'm in the this is a section of the brachial plexus if I'm working on the arm. But do I really know that that's what I'm working? Like, I can have a general focus on something, but it does get to this point when you look at the pain science, I'll mention this very briefly, it gets to the point where they almost start to say that we're not working muscles. That when you work on the psoas, are you really making contact with the psoas? And then Walt Fritz will do this to me, and Walt and I will go back and forth. If you haven't checked out Walt Fritz's stuff, I recommend it, by the way. He's one of the few educators that I do recommend people study with. And Walt Fritz will come up against me because Walt will say, stretches skin. And I'm like, all compression stretches skin, Walt. I'm not talking about pounds per square inch, but the thing is, are we really working on the bicep, or are we accessing nerves because we're stretching cutaneous nerves and accessing subcutaneous nerves by accessing the dermis, accessing the skin itself? I think that's a more correct way to talk about that in scientific terms, but it's not going to get you very far marketing to clients. I am a soft tissue nerve specialist. What? Like, yo, bro, I got back pain. Can you help me? So there's a difference in how we're going to address that verbally. I want to be able to bring Thai massage, which is what this is, biomechanically, by the way. But I want to bring it into the 21st century with pain science. I was also a yoga teacher. Was I looking at nadis and energy flow and chakras? I started looking at the pain science. And then once you start digging, you're like, oh, everybody's arguing in 9 different ways because we haven't broken it down so efficiently and so descriptively that we just answered it in the way we have with physics. They're like, what does this particle do? They reduce it down to a single particle. Once you get to biology, it's a little more difficult to isolate. So as we're going along, remember, there are some contraindications, okay? If people had recent surgery or some kind of mesh, if people have unmedicated blood pressure issues, like severe abdominal pain, or maybe like a hernia that you know about. Now, you might be able to work around the hernia, by the way, but what I want you going and like pressing on it, well, no. I mean, mostly that's just common sense. What I will say is, as we do this, it is best to have really ample verbal communication with the client. I do think that you can help people with pretty severe issues if you use this and if you go slow within what they can take. Our sequence got like a little change just because she was having such a deep response to such light pressure that I didn't want to force her to feel more than she was. Make sense? Yeah.
Thank you.
Yeah. So from here, we're going to bolster again. So I'm going to go ahead and see here. I got these guys just tossed to the side. We're going to have to redo this. So I'm going to, in my case, I got 2 blankets. I'm going to take them and just roll them up. See if I can get those under her legs. It makes like a big roll, right? And I'm going to put one on either side. I prefer to do this. So I'm going to put one there.
Wow, that's good.
There we go. And then I'm going to take the other and roll it up. If you had a client and you worked on them and you felt like they needed some of this, but you felt like, and I had this before, I used to work in a chiropractor's office. How's that right there? Cool. And I can even just rock the legs just to see, like, all comfortable there.
Feels so good.
Okay. What I might do is something like this. Let's say I did some of the work that rocked the hips and legs, and it's like they were still having that weird low back pain. I might say, listen, I think you're having an issue with your psoas, and I might come in and literally find their navel and just start to sink pretty deeply. And I would say rapidly. Compared to what we started with, I would say rapidly. Where I go in and see if I apply some pressure in there, not with Danielle, but if I apply some pressure in there, do they have a response where like it lit up that area in the small of their back? When I press through the abdomen pretty deeply down towards the psoas, do they have issues when I'm pressing over there? That's it right there. Do they get that weird referred pain? And then here's what happened. What that did is created a situation where I can now educate that client and say, listen, we did your session today. I think you're having an issue with that muscle, the psoas. I might walk over to a chart and show it to them. On here I have graphics. Then I would say, listen, I'd love to do another session where I do some abdominal work to kind of get into that. What he did is you kind of opened it up for them. You kind of help them expand beyond what they think of as massage, because normally they wouldn't expect a massage therapist to come in and do that stuff at all, right? I mean, most clients at least. So to go ahead and prep her, I'm going to go ahead and ask again. Like I repeat this just so you guys can see it, remember. I'm going to say, hey, listen, I want to be able to take your shirt like up to your bra line. Mm-hmm. And in this case, it's really easy because she's got two. I'm going to lift the first one and say, is it okay if I lift that up?
Yes.
Okay. Then I'm going to lift that first up, and then is it okay if I lift the second one up to about that line as well?
Yes.
Okay. There we go. And then from here, I'm going to lift it up. And then, yeah, she's got like this great bra line right here, so it's easy to expose all of that. Then I'm going to take my towel, and just like before, I'm going to lay this down, which is interesting because she feels covered again, right? Then I'm going to start to tuck this down and in, and I'm going to go out to these outer edges over here, just so I want to make sure not to get coconut oil in her underwear or pants. How's all that?
For me, it's a little more comfortable.
Down a little bit?
Yep.
Cool, right there?
Yep.
There you go. And then here's the thing. She pushed that down just a little bit further. I probably wouldn't do that for her, especially the initial time. But what it does is it tells me that she just feels comfortable working with me. I'm like totally fine with that. So from here, I want to go ahead and I think I'm going to start on the opposite side than I did last time, just because I want to change it up. And we're going to go back to the trusty coconut oil. And bring my stuff over. And once I get some on my hands, again, we're going to hold it there. I think I got enough, but I've got it here in case I need to grab more. And you can see there's like a solid chunk in my hand there, but I want to melt that. She's already getting like a small drip over the edge. I'm going to smoosh that out, smear it out, smoosh. Very professional language here. I don't want you to have fear from working on this area. And part of what helps with that fear is getting into the shallow end of the pool and doing just a little bit of the work. I've still got my hand like this. There's still some solid there, but I'm working my way around, making small little circles. And going slow. just smearing that coconut oil around. Now that I can see all of that has turned liquid, I'm just going to make broad palmar pressure around just to spread that more. This is one of the few areas where I do use oil. I think it makes the abdominal work stand out more. I rarely use any kind of oil or cream unless I'm doing this or maybe footwork. I might use some shea butter for that, which is very common. It's very hydrating for the feet. The Thai style foot massage class, I'll probably teach that sometime next year. Is that too much? Make it just small little circles. Big, broad palmar circles. Too much there?
It's like right on the line.
Right on the line. So I'm gonna back off, and I don't even remember, to be honest, exactly how we got, like, because we went off road with Danielle real fast last time. I'm gonna change this because I'm gonna come in and show you. This is sometimes what it'll look like, and you don't have to do this. This is not magic. There's not magic points and lines, and no, I just don't. I don't buy that. I don't believe that. That's not what my experience has been. I'm gonna take my fingertips, okay, and my fingernails, have been trimmed very, very short, but I'm gonna use the soft part of my fingertips. This isn't like pointed, okay, and I'm gonna make just small little circles, and these small little circles are gonna go around in a circle. And I can't even remember how I got there last time, but I think we just started using deeper palmar pressure, and she started getting referred stuff, and then I'm like a bloodhound. I'm like, oh, I smell pain and weirdness, so we started going into it. Just gonna make little circles. Really just moving around here. And her demeanor here is like much, much, much better. This is so superficial. She's just like, oh, that's cool. You're not gonna hurt me. She has a very different response to this. There's enough coconut oil there to coat. Slowly the circles get a little bit larger. And if it's ever too sharp, just let me know.
It's a little too much.
A little too much?
Yeah.
Is it too fast or too deep?
Too sharp.
Okay. So she said too sharp and too deep. Okay. So do you see why last time in her case it was palmar? What I'm doing is I'm trying to back out. So instead of being like this, okay, my hand is like this. Instead of my fingertips being up and pointed, I'm going to come down like this. And I'm going to do broader pressure. See if that works.
That feels better.
There we go. And it was just for her. And that's what I mean about the communication part. It would be very easy for me to just overwhelm her. Because it's like, well, no, I got to do the thing the way I was taught, you know. And it's like, but people's bodies just respond in like wildly different ways.
Mm-hmm. I volunteered for this, by the way. So.
And then because I'm using like broader fingers, like I'm almost going to where it feels like mid finger about there. It's not just like up here, it's almost about mid finger. Then I'm just going to make like slightly larger circles and go around.
Obviously I have a lot of protection going on.
I can't imagine why.
And guarding, but this feels okay. Like I feel safer.
Deep compressions on other parts of the body, I love. But even me, like if you ever work on me, got to go slow. If you give me time, my body completely just unwinds if you use a broad enough tool. But if you come and just dive in with an elbow, no, nothing relaxes. It's like protection.
Yep.
And just a little bit broader. I'm going to start to just broaden my whole palm. Big circles around. Big circles. Gonna grab up around the rib cage. You can go deep, but you got to go slow. In the Intro to Thai Massage workbook, I talk about general to specific, superficial to deep. You've got to get the person to trust you to get anything to relax and let go. You don't want to break trust. Do I sometimes, particularly with Kristen, I find, because I work with so regularly, I sometimes give the apprentices or students or people a little bit too much pressure, just so they can see what it feels like, and they're like, ow, like it, makes them tighten up. But it's also to give them a sense of how we deliver pressure and what the human body can take. But they're fine. It's fine. I naturally, like, I've grabbed some skin, and it's like I'm sliding over, but I just slowed down. Like Danielle, like our facial expression changed, and it was just like she just fell in. Like she just went, whoop, hey, we're doing something. Whenever you are doing this, you have to make yourself comfortable. Now, this is one of the reasons I love mat work, because I just get to hang out. But on a table, I could very easily, again, I could have this thigh up on the table and have this leg down on a chair so that I can kind of sit on the table with the client. I could have them scoot over to one edge. Is that too deep? Too fast? Okay. To be able to get down to the psoas, you're going to have to do some of this superficial work. Even that the beginning thing where I'm making those little circles with the fingers, don't underestimate that. Don't think, oh, this is just, I just wish we could get to it. No, you're just peeling back layers and creating a sense of safety so that they'll allow you in. You're not going to be able to battering ram your way into like good abdominal work. It's going to completely overwhelm them. It's going to make them uncomfortable. You're going to have to go in slow. Josh Terry is a friend of mine. He used to come to the Thai Massage Jam, and I remember, oof, man, I did some. He had some low back something or other, and I worked on Josh one time, and I rough up Josh because Josh is my friend. I know him real well, and like, man, I was leaning to him. Josh just started crying at the jam in front of everybody, and I'm like. He's like, I don't, like I'm deep in his abdomen. Hey, he's crying. And he's like, I don't know why I'm crying. And I'm like, it's normal. He's like, it's just real intense. And I'm like, yeah. But it's like the tears weren't connected to anything in particular. It was just this very intense sensation. And he was having this sort of spontaneous emotional release from it. I went super slow. I was kind of making laps, and then I slowed down to 1/8 the speed of what I'd done before. I'm gonna reach over to this side and get that little bit of pull again. And then she gives me the thumbs up. This is the universal sign. I mean, I don't know. I have to go around the world and figure that out, but I'm pretty sure this is universally the sign of like, yes, do that. Too sharp? Okay. So as I'm coming, the edges of my fingers were catching. So I'm going to try next time to grab with more just the full palm. Not too sharp?
No, that's good.
Good there. And my fingers started to become sharper. You can, if you really paid attention right there, you can see that I flattened my hand more so I could like traction skin over this way instead of it like being sharp, instead of digging those fingers in.
And I feel like referred feeling traveling down towards my groin and down my leg again.
Okay. And it's down just on this right leg?
Yeah.
Okay. I'm going to reach a little bit lower this time. Same sort of thing. I'm just stacking body weight so I can lean. Just grabbing right there. And my fingers, again, I started to I'm going to grab. And I'm like, no, just broaden up, just broaden up. Because she seems to be able to accept that broad much easier. So I want to do stuff that's easy. I don't want to work hard. I need to get in this business and work hard. And I'm broadening the fingers because I don't want to dig them in. There's still some pressure with the palm, but I'm not like digging the fingers in. And then slowly I'm gonna go one pass. And again, this guy really gets, I think, to the top of those ilia. Like I'm really over the bone right here, but I'm able to lift her lower body. I'm able to lift her lower back. I've got a good grip with my fingers curled just a little bit there. And as I come around to the side, I'm gonna take that edge off and like broaden the hand just a little bit more. But even from this before, she was saying she was getting that little bit of referred pain, like down and over. Right in there. And I'm broadening the fingers. You can see there, and I let go just a little bit.
I feel that like all the way down.
And very, very light pressure. This isn't a lot of pressure. She's getting that referred pain. Also, you know, it's interesting, like she just responds as we go, but she had like her hand up for a second, like around her head, like it's like trying to process everything that's going on while we do this.
Like I feel it like lining up now right around that hip thing that I can't think of words.
Inguinal crease?
Yes.
Yeah.
And like it went all the way down and across and down my arm.
Do you want another pass through there?
Yeah,
Do you want the higher portion or lower?
the lower?
The lower? It's kind of the same area?
Yeah.
Okay. So I'm going to come up, just got to kind of position my body here. Going to get a good grip. Oh, and this is going to be totally gross, by the way. If I get to the point where I'm about to sneeze, I felt the sneeze coming on. So this is how I handle this in class. And I bring this up just because you guys need this in case this goes down. So you're working on somebody and you're in the middle of this and you feel like you got to sneeze. It's gross, but as I take my shirt and put it over my nose so that everything is covered when I sneeze, and then I can, yeah, it's gross, but it gets the job done, and the clients feel nice that I don't sneeze on them in the middle of COVID. Yeah. How's that right there?
Okay, you can go a little deeper.
A little deeper?
Yeah,
Okay.
a little bit.
So I'm going to reach in just a little bit more because I was getting like feedback. I'm going to hook right along those ilia. And she gives me a good response from this, which is why I do it. You know, I wouldn't even really focus on this if I felt like it wasn't beneficial to her. But for some reason, this in particular, she starts to get that referred pain. It feels a little bit better. She says it feels nice. And you didn't nearly feel it as much on the opposite side, right?
No.
Yeah. Right up through there.
Yeah.
Is that too much point on my fingertips?
No.
Okay. So when I'm in the soft of her abdomen, she can't take the sharpness. When I'm over her ilia, she doesn't really bother her. She actually likes it.
Yeah.
Yeah.
I don't know what is up with my abs. I do not like it.
Gonna slowly go to the opposite side. If I need to, if I want to, clean off my left hand because I'll be using my right more, I'll usually just grab the towel here and use this portion to wipe my hand off. I'm gonna do the same thing, opposite side. Probably give her a little more attention on that side just because she was feeling it more. As you're following along with us, feel free to like switch it up. Don't feel like you don't have to do it just the way I do it. We're exploring together. That's the reason for these classes. I'm gonna start just a little bit higher, up along the ribs here. I'm gonna scoot down and forward there. How about that? And on skin, how's that right there?
Oh, it feels great.
There we go. This rotation through the torso. So much of what we do is subtle. It's like how you interact with clients, how you interact with tissue, how you communicate with them. You learn to read facial expressions. You learn to glean information from nonverbal communication to be able to alter the session. And I'm pretty slow here. She seems to have kind of fallen in. She's relaxed, so I'm giving her a chance to just settle down. This isn't as gruff. It's not as sharp as some of the work where you're pressing down through the abdomen. And because of my position, I've started to come down just a little bit. I feel like I'm getting over towards like the floater ribs. And I've got my arm extended. I'm doing my best to allow my torso to lean, to pull this arm over. You see how it's extended? I'm not doing this where I'm pulling with my arm. I'm really just allowing body weight, and I'm leaning over because I can sustain that for a much longer period of time. As I'm up and over that edge, I'm going to soften my hand just a little bit. So I'm going to just pulling skin. If for some reason you feel like you need to turn your body around because you want to use the other arm, totally fine. We talked about that from the other side. It'd be very easy to just change my body position where I'm facing the opposite direction to do this. And I soften even more as I'm around the edge here. Then I'm going to reach down and around. And what do you think? Is it down towards the pelvis again? Yeah. Down towards the ilia, like when I grab there? I'm almost grabbing almost to my elbow right here, almost. And then leaning and pulling up. She's getting like a little bit of a twist here. You can see where I'm lifting her off the ground. Does that feel good? Is it too much where my forearm is digging in right there?
A little bit, yeah.
A little bit? I'm going to back off just a little bit. Is that better?
That's better.
There we go. See that little thing? She might not have said anything, but I just felt like, hey, you got your forearm digging in there a little bit. Just ask. Because she can always tell me. One of the things I do, and Daniela and I have a background. We work on each other, so there's some communication already established. With new clients, when they tell me yeah, that's a little too much pressure. What I like to do is say, listen, thank you so much for telling me. I'm always amazed how many clients will just sort of grin and bear it. I want to make the session the best we can for you. So at any time it's too much pressure, you let me know. The other portion is I may tell them, when you get me to back off, it's easier for me. I don't have to push as hard. I'm going to soften again, just kind of broadening my hand. Still with this long arm leaning. I'm broadening the hand. Very low and slow in this case. Very low and slow.
Right, I have menstrual cramps.
So the right sides?
Yeah, it's just I'm having menstrual cramps.
Okay.
It's not what you're doing here.
So in other words, I'm over here, but you're feeling menstrual cramps.
Yeah.
Okay. But it's not because of what I'm doing.
Correct.
It's just because the velociraptors have, yeah.
Innards are trying to become outers.
Taking their toll.
Yeah.
So after I go on this pass, I'm going to broaden over the abdomen again, and we're going to get ready for those slightly deeper compressions. But again, we're just mindful of where Danielle is at. I'm working on her twice. I was happy to do this class with her because I know that she's a little more tentative about the abdominal work generally. In the second and third class, we're going to go over like additional tools that you can use with like fingers, reinforced fingers, side of hand, forearm and elbow, stuff like that, little deeper compressions. And as I'm doing this, I'm going to back off again, just these like big kind of circles here. She liked, I remembered this, she liked when I would kind of pull up and over. So I want to do some very broad, light kind of strokes like this because she prefers this.
Oh, very nice.
And then, because she prefers that sort of pressure, I'm going to reverse it. So I'm going to pull from over here. And this feels topical. This feels almost like just skin. Almost like a Swedish kind of stroke. Over the top. And one just a little bit lower. And in her case, I'm going to find abdomen and then just about 2 inches or so below. The heel of my palm is going to be there, but I'm going to be a little bit broader because I know that she, only responds so well to pressure. Going to sink in to see what her response is. I immediately take my face and I start to look at her like we're making eye contact, because I'm trying to see, how her facial expression changes. And then I get to this point where I've sunk through some tissue, but I feel like I hit a bit of a wall. And I could go push on it, but she'd shake her head no, just like she did, because she doesn't want any more than that. Is that too deep?
No, it feels like you're right there.
Like
right where I need it to be.
Right where. So
Yeah.
do I need to move any certain direction?
No.
Okay.
Just let me work through it.
Yeah. And when she's going to work through it, she starts breathing. She's learning now. Oh, okay. So I deal with the deeper pressure by changing my breathing. My preference, if Austin allergies are not killing you, is you breathe through your nose and then out the mouth. Yeah. When you said okay, you mean I'm good for today?
Yeah.
Or no more?
No more.
Okay.
We can back out.
Okay. I'm gonna back off just a little bit. Thank you for letting me know. And there's the thing, I wasn't straining. I wasn't working hard at all. She just told me, hey, you can back out a little bit. I'm like, cool. Because all I do is just lean out just a little bit.
Oh, I feel that in my back now.
Okay. Where in your back?
Or right directly all the way to the floor back.
Okay. Does it almost feel like there's a line connected to where I'm pressing, like straight back?
Yes.
Okay. Referred pain?
I guess so.
Okay.
I mean, I feel I don't feel the topical because I'm numb there.
Yeah.
I feel, I guess at least my hand width below the pressure, and then I feel the pressure on my uterus, and then I feel like you're talking about a line straight to my back on the floor.
Okay.
That's as best as I can explain it.
Yep. And the referred pain in this is some of the strangest stuff in the body work that I've seen. I'm going to very slowly just back out because of that one spot. She immediately, her breathing changed because she was at her edge and it was hard to breathe. But when I backed out, she went, I can, let go again. I'm going to give her just several breaths before I go in again. I was already on this side, which is why I chose to do that lower portion first. How your legs there? You okay?
Yeah. My thigh joint's a little angry.
Okay. Almost like, I hate to say causing low back pain, but when you soften all that girdle through there. Yeah. Do you need to make small shifts or changes to your position?
Yeah.
Okay.
Can you move my leg there?
Sure. Which one?
My right one.
Right one? Okay. Is stuff going to sleep?
No, it's gonna hurt if I do it.
Oh, okay. So when you say move it around, do you mean to just rock it?
Yeah.
Gently? Yeah. Now she requested this because she was having some issues. How's that?
Yeah, no, I can do it.
Okay. Do you want me to prop this leg higher? Or you just manually wanted to shift?
Oh, I just needed to shift.
Oh, okay. Cool. Are you going to be comfortable putting your leg back down?
No, I think I need to do this.
Okay. So can you hold it there?
Yeah,
that's fine. Okay. So the reason I ask her that is I could grab a much larger pillow and bolster her leg like this, but she's saying that she thinks she'll be able to hold this without there being any issues. So I'm just going to go on to the next spot, which again, the navel's here. I'm going to come 2 inches to the outside. Now instead of the bottom, I'm at the side. And then you give me.
That's good.
You back there. Okay there?
Oh, I feel that it just feels like a spider web.
Spider web.
Yeah. Oh,
Like a lattice goes all through there.
Yeah, and then now I feel sharp pain shooting down directly. Oh, it's good.
Okay.
Stay. I feel lots of sharp pain, I'm gonna guess it's my ovaries. Oh, I hate that. Does anybody want one? You have it.
Now, this is also, when you guys are watching this is the second time I've worked on her. I think this may be even more pronounced than the first time, but it's because we softened some of the superficial stuff. I'm going to go ahead and slowly back out. And then I'm going to go to the spot that's above, because we're just doing, you know, to the side, down below, to the side, up above. I'm going to curl my fingers in and I'm going to get oil on her clothes. No more than that. And she shook her head. She's like, yes, no more than that. Please, I'm good. Right there. Do I need to shear any direction?
Down. Maybe.
Right there?
Yeah.
Now, I have no idea why she steers me down and over. At this point, I could shear and give her an option, but she just told me, yeah, down and over. And then she's like, right there. Encouraging that communication with your clients is going to get you to the good spot, the sweet spot, much more rapidly.
And I feel safer too because he's actually listening to where I want, especially with my hesitation and anxiousness around my belly. So I'm able to relax in a little bit more, and I feel like we're able to get a little bit deeper this time around. Probably not deep, like most people. But.
Any referred pain from that?
No, not anymore. Well, except for that one.
And you just had a light tinge.
Yeah.
Okay. I'm going to slowly, again, just going to back out. And unfortunately, guys, listen, I think it's boring on camera. It just is not. It is not the flashy stuff that people want to see on YouTube, for sure. But very profound body work. Like, this is very, very transformative to people. And I think most consumers, even massage consumers, have just frankly never had this. I'm going to come in now to this last point over here, and I just changed sides so it was easier for me to deliver a little pressure. Again, I find the navel, come just about an inch or two over, and pretty big, broad palm. No more than that?
No, I feel that again.
Refers down.
Yeah.
Is the lattice again, that little spider web thing you talked about?
Yeah.
Because she is on her cycle, I would likely reiterate, hey, your cycle may be a little bit heavier this time based on what other women have reported to me. No cause for concern. Many women tell me that their menstrual cramps actually ease up after I do this. And then you don't want me to shear any specific direction.
You try down.
Okay. Down and in.
Yeah.
Right there?
Right there, yeah.
There we go. And again, she steered me down and in.
I don't know why. That's just where it feels.
Yeah, and for me, there's no judgment about it. What I do know is the sessions are better because I allow the client to communicate with me about what they're feeling and where they want me to go. That doesn't offend me. It doesn't feel like they're trying to control the session. But there is definitely a reciprocal relationship where I'm communicating and vice versa. It's also one of the reasons that we as body workers want to get work regularly, because it's important for us to put ourselves in the client's shoes where we're trying to relax and somebody's pummeling on us. Hey, a little too sharp, a little too fast. Pressure still good? There we go. Then very slowly, I'm going to back out. She's going to get a couple of those good breaths without any contact from me so she can, settle back to normal. I'm going to use the top portion of this towel just to wipe my hands here. And then I'm going to take the towel, this upper portion, and go ahead and wipe her belly so we can get any of that coconut oil. I'll usually bring it right up to the line and then actually reach it around. This is very light. This isn't like super, super deep. This is actually using some of the traction from the towel to be able to mop up any of that leftover oil that might be on her abdomen. It also just feels nice because it's very broad pressure compared to what we were doing before. And then I'm going to bring this guy down, and then very slowly I'm going to grab along the edge here and just start to pull this up and out. And then we can go ahead and grab the edges of her pants, make sure not to grab skin. We're going to pull that up and then slowly pull her shirt down so she's covered again. I'm going to take this. I can go ahead and just, wipe up my hands and arms if need be, just to mop up any of that extra oil. Again, we had this guy down, this green sheet, just to catch any extra oil that was on the sheets, just to try to protect ours. That's a good overview of the basics of the abdominal work just to get started. We're going to build on what we just did and go into more in the following classes, meaning that we're going to expand, use fingers, reinforced fingers, side of hand, heel, reinforced hands, building up to forearm and elbow to deliver pressure through the abdomen. When we're going through, keep in mind, these are good questions. What are we doing to smooth muscle tissue, to lymphatic flow through the abdomen? What does it wind up doing to the structures in the SI joint, lumbar spine, sciatic nerve? What is going on in relation to the psoas, the QL, that little bit of twist that we were engaging in, iliacus, and then how's it affecting the posterior chain? The posterior chain gets a lot of attention. The anterior chain through the abdomen, through rectus abdominis, as we're softening all of that, is the one that is getting the work now. What is the ongoing effect through the parasympathetic and sympathetic portions of the nervous system? Rest and relaxation is working the abdomen. Rest and relaxation is digestion. When we go into fight or flight, our blood flow is diverted elsewhere because we got to run away, right? Or fight. When we go into the work, we're always keeping in mind, you don't want to have fear because it's a new area, right? I'm trying to give you the wading pool, and then we slowly go a little bit deeper and a little bit deeper as you feel comfortable. A lot of the way you're going to get away from that fear, if you will, is just communicating with the client more. There are certain core contraindications that we've got listed there, particularly like mesh and abdominal surgeries. A lot of it, I think, is just common sense. Some of what we think of as a contraindication is just a caution. When you communicate effectively with the client, especially verbally, if you make sure that they have their own autonomy, they know that they are in charge of the session, so to speak, that can go a long way to communicating with the client and making them feel safe and secure. And we're going to go ahead and continue. Remember, next week we are not here. We come back on the 19th. I'll make sure to send you guys emails in advance with the link information. Danielle, do you have any closing notes?
Just listen to your clients and don't be afraid to get in there when you can. And obviously, you can do Thai work gently, especially with someone who is very sensitive to pressure or having pain. And that's it.
Cool. So listen guys, thank you so much. I'll see you again soon. If you have any questions for me, just text or call. You can also send me an email. I will email you the link for the next class. If you have any questions between now and then, just write me. I'll be happy to chat with you and answer. The next 2 classes, I'm going to be on a mat, but don't feel like you can't do this on a table. Again, what I want you to be able to do is maybe partially be able to sit on the table with your foot down on a chair, because putting yourself up means that you're going to be able to lean in a little bit more easily than if you're standing beside the table. You guys have a great day, and I'll talk to you again very, very soon.